So this is someone we know. This is Anya on the screen, and Anya is part of the sandwich generation. She has a couple of kids at home. She also has an aging mother at home who she worries about because she's on a number of drugs. Her mom doesn't speak perfect English, so she has some trouble interacting with the doctor. And Anya is not sure if her mom is actually using her drugs properly. Unfortunately, Anya is not alone. In North America, 3 million people, elderly people, are admitted to nursing homes every year due to issues with their medications. This totals more than $14 billion in costs to families and health insurance. Drug misuse represents 30% of all elderly hospitalizations in North America. And as dosing gets more complicated for these older people, the risk of hospitalization increases. As you can see, when you're going from 1 dose per day to 4 doses per day, the number of hospitalizations in a 6-month period goes up dramatically. We believe the solution we've created to this is the LifeCapsule. This is a smart, scheduled pill box that you can see over here that connects to the cloud and allows someone who cares about this person to set up a schedule and receive notifications that they're taking the correct drugs at the right time. They're not taking too many, too few, or the wrong ones. So in the short term, what we're looking for from you, the judges, is mentorship and helping build out a channel partnership. We believe that the best sales strategy for us would be to have a channel partnership with a large pharmacy chain such as Shoppers Drug Mart or Rexall. We believe this could be an upsell on the dispensing fee for medications. So while someone is at the counter picking up a prescription for their parent, for their grandparent, the upsell is for an extra $2, you can track this through the LifeCapsule if you're willing to try out the hardware, which we believe we can make for under $50. Yeah, so we're looking for your help and your mentorship to build out that sort of strategy, and that's our business plan. We did some validation of this idea. We talked to a few people in the medical industry. We visited the ER ward at Mount Sinai Hospital earlier today, and we talked to the on-call physician there. He told us that they actually see quite a few people coming in because of issues they've had at home with taking the wrong medication or too much medication. His exact words were, it can be a little bit hit or miss when you have people at home without supervision taking these drugs. We also spoke to a pharmacist at Rexall, and we specifically chatted with her about Rexall's new program that they offer, which is an automated update when you're coming close to renewal time for your prescription, where they'll give you a phone call. We thought this would make sense as another added feature onto that. Also, our friend Anya gave us a direct testimonial, which is I'd easily pay $100 or more for something like that, especially if it could remind a loved one and also send me a confirmation email when he takes them. So she'd be willing to pay $100 for that device, and we're looking at pricing around half that. Another side of the story, so we're looking at 2 different models here. One side is for your parent, grandparent, loved one, someone you're caring for who's forgetful. They're a little bit older. They sometimes forget to take their medication. They get confused. Maybe they take the wrong pill. The other side is someone who has Alzheimer's. We talked to someone who had a grandparent with Alzheimer's and also had arthritis and a lot of back pain. So when you have back pain, it's very normal. You go to the cupboard and you grab an Advil. Now, this person didn't realize that they were taking multiple Advils. They kept going back to the cupboard and getting another. They still had a back hurting. So there's a real risk of overdosing. So not only will this tell you when it's time to take a medication, it'll also tell you if you've already taken that medication. We'll give a quick demo of how the hardware works now.
So basically, it's a general, regular, nothing special pill box that you can buy in Shoppers. And when you take it out, you take out the pills, hopefully not you, place it back, and as it said, you already took it. The schedule that is uploaded from the cloud, that obviously is set up by the caregiver, automatically specifies that you already took it, don't take it, it's good for today. So it expands from this to a much bigger solution than just tracking how much drugs was taken.
I think that's just about it on time. So we'll open the floor to any questions you might have. Pardon me? Oh.
Questions? How about a question from you? We need one.
By the way, what you saw right now is actual live streaming of that device through the router that is over there onto the cloud service.
Sorry, can I get you to expand on how it actually works and how it's assessing that a pill is being taken and just one pill?
So it has to be very simple because whoever is going to be taking is an elderly person who can't understand latest technology or configure it or do anything complicated with it. Hence, for the person who is taking the drugs, it's just a box into which you put your regular pill box. Inside, you have light sensors and light emitters that periodically check so essentially emit light and check if there are any contents inside. Based on the schedule that you have, which you set up, it will start notifying you by blinking that you need to take your drugs. Now, that notification can be not only by like LED, for example, but different means. So that will be the sort of the basic thing. You place it back. From the point of view of the user, it's very simple. From the point of view of caregiver, they get notification immediately if the drug was taken, or if it wasn't taken for a while, then it escalates to a call, SMS, or something like that. So that's a basic setup. It has to be very easy, very simple, because otherwise it will drive the cost up.
The idea is that the caregiver, so in this case, Anya, right? She would have a smartphone, and we build a mobile app that allows you to pair her mother or her father's smart pill box with the cloud service provider through the phone. So we have a QR code there. We go to it, you scan it, and at that point you establish a connection, and then the device starts sending information up to the cloud. And Anya gets immediate notification in her app to let her know when her mom missed a schedule or when her mom she took her medication.
Actually, I think it would be a useful use case would be for clinical research organizations doing drug trials. So often it's very critical to them that the drugs are taken on schedule, particularly because there's an entire research thesis built on that. Have you looked at that market?
We looked at that as well as nursing homes, where this is a big problem, and nurses have to take care of essentially remembering or knowing to keep in track, where this is going to take care of it automatically, sort of. So that's one of it.
Yeah, so in the short term, we really want to focus on building out the validation and completing the prototype and completing the basic functionality. In the long term, some other business ideas we have is to look into the health insurance industry. In the United States, private health insurance is huge, and there could be incentives for health insurance providers to provide this type of device to customers, because hospitalizations are very costly, and this could cut down the number of hospitalizations due to incorrect dosage. We'd also look at extending to some other devices or sensors that could connect to this kind of home hub. And we'd also look at getting into long-term care facilities or other business models, as you mentioned, such as clinical trials, definitely. Here, Chris.
I guess this is more of a comment than a question, but I think it's a huge problem and an important problem to try and solve. And I wonder if your approach of keeping it simple and low cost is actually the wrong approach, because people would spend a lot of money on this, whether it's the end users themselves or their children, or it's health insurers, or it's government. I think you could actually get into something that's a little bit more complicated, but does a lot more, and therefore has a higher cost.
So in order to get into that market, you have to get in at a low price, because they have to be interested to at least try it out. Now, very important point that you brought up. The device cost is low. The subscription fees are also going to be low, but they're recurring. If you want to keep up this service, you have to be in that subscription fee. That's where the revenue comes in, not from the actual price of the device. It's the same. If you're not interested, if not working for you, give it away. You didn't lose anything. So that is the primary business model in terms of actually generating revenue.
And Chris, I would just add one quick point to that is that both the ER doctor and the pharmacist we spoke to had not heard of, we mentioned some of the higher cost devices. There are devices in the $500 to $1,000 range that actually do dispensing and do a lot more higher functionality type tasks. They'd never heard of them, and they'd never heard of anyone who had it in a home. So that was why we wanted to continue focusing on the low cost. Yeah. Cool.